Hi, this is Mrs. Samna, optometrist from Global College of Allied Health, Natalam. Today we are going to discuss about the topic Ectopia lentis. Ectopia lentis is a congenital bilateral sublux vision or dislocation of the lens. In sublux visions, the lens is displaced sideways but remains against the pupil. But in dislocation, lens is moved either forward into the anterior chamber or backwards into the vitreous. The symptoms are mainly optical. In sublux vision, the lens becomes more spherical, producing myopic astigmatism. In dislocation, the eyes becomes hypermetropic with loss of accommodation. The migration of the dislocated lens into the anterior chamber or vitreous causes secondary glaucoma. Signs: an irregular deep anterior chamber with tremulousness of the iris. The diagnosis should be confirmed after full dilatation of the pupil. The edge of the displaced lens appears in the pupillary area as a dark crescent in oblique illumination. Causes: Marfan syndrome, homocystinuria, Weil-Marchesani syndrome, hyperlysinemia, familial ectopia lentis. Next topic is sublux vision of the lens. This is a condition of the lens in which a portion of the supporting zonule is absent and the lens lacks support in that quadrant. In sublux vision, lenses usually remains in the pupillary area, though there may be a tilting or displacement in that meridian. Causes, which is under the two category congenital ectopia lentis and acquired ectopia lentis. Symptoms: monocular diplopia, dimness of vision due to myopic astigmatism. Signs: unequal depth of the anterior chamber, tremulousness of the iris. The diagnosis should be confirmed after full dilatation of the pupil. Edges of the lens is visible as a dark crescent line in oblique illumination. Indirect ophthalmoscopy may show two images of the disc due to the phakic and aphakic zones of the pupil. The secondary glaucoma may be present in some cases. Treatment: if the lens remains clear and there is no irritative symptoms, glasses are prescribed against phakic part of the to correct lenticular myopic astigmatism. Alternately, if the phakic zone in the pupil is more, aphakic corrections may be considered. In the presence of cataract or irritative symptoms, for small zonular tear, ECCE with PCIOL may be considered. If the zonular tear is more, the intracapsular cataract extractions with pectic treatment is a treatment of choice. Sometimes a scleral fixation PCIOL can be recommended. The next topic is dislocation of the lens. In these conditions in which the crystalline lens is completely unsupported by the zonules so that the lens is completely displaced from the pupillary area, which is either fallen anteriorly into the anterior chamber or posteriorly into the vitreous humor. Causes: same as sublux vision of the lens. The deliberate dislocation is in the vitreous cavity may be an ancient surgical procedure which is called couching or reclination, which is still sometimes practiced in rural area by the quacks. Symptoms: marked dimness of visions for the distance and near due to high hypermetropia and loss of accommodation. The slight improvement of the visions in dislocated hypermetropic cataract. Migration of the dislocated lens into the anterior chamber or vitreous give rise to the symptoms of uveitis and glaucoma. Complications: secondary glaucoma, severe iridocyclitis, vitreoretinal degeneration. Treatment: